your kidneys could be losing function right now, and you would feel almost nothing. No alarm. No dramatic pain. Just a slow, quiet erosion happening beneath the surface of an otherwise ordinary day. That is the unsettling truth about kidney disease. It is often called a silent condition because by the time most people notice something is wrong, the damage has already been progressing for months, sometimes years. According to the National Kidney Foundation, nearly 1 in 7 adults in the United States lives with chronic kidney disease, and the majority of them do not know it. This is not a story about sudden collapse. It is a story about small, easily dismissed signals that the body sends out long before a crisis ever arrives. To understand why kidney failure is so difficult to detect early, you have to understand what these organs actually do. Tucked beneath the ribcage, each about the size of a fist, the kidneys filter roughly 50 gallons of blood every single day, removing waste, balancing fluid, regulating blood pressure, and producing hormones that keep bones strong and red blood cells healthy. They are remarkably resilient. In fact, a person can lose up to 90% of kidney function before symptoms become impossible to ignore. That resilience is a gift, but it is also the very reason so many cases go undiagnosed until dialysis or transplantation becomes the only option. The Mayo Clinic and the National Institute of Diabetes and Digestive and Kidney Diseases have both emphasized that early detection through simple blood and urine tests remains the most powerful tool against this disease, precisely because the symptoms themselves are so easy to overlook. The first sign worth paying attention to is persistent fatigue that does not improve with rest. When kidneys begin to fail, they produce less of a hormone called erythropoietin, which signals the bone marrow to make red blood cells. Without enough of it, the body drifts toward anemia, and anemia manifests as a bone-deep tiredness that sleep cannot fix. People often blame this exhaustion on stress, poor sleep, or simply getting older. They push through it, unaware that their blood is quietly becoming less oxygenated with each passing week. This is one of the cruelest aspects of kidney disease. The symptom that should raise alarm instead gets absorbed into the background noise of modern life, mistaken for burnout, mistaken for a demanding job, mistaken for nothing at all. The second sign is swelling, particularly around the ankles, feet, hands, or face. Healthy kidneys remove excess sodium and fluid from the body. When they falter, that fluid has nowhere to go, so it pools in the tissues, most visibly in the lower extremities because gravity pulls it downward throughout the day. Many people notice their shoes fitting tighter by evening or a faint indentation left behind after pressing a finger into the skin near the ankle. It is often mistaken for standing too long, eating too much salt at dinner, or simple aging. Rarely is it connected in the moment to the organs working quietly inside the abdomen, doing their best to compensate for a system that is slowly losing its balance. The third sign involves changes in urination, not in a single dramatic way, but in several subtle patterns. Foamy or bubbly urine can indicate protein leaking into it, a sign that the kidney's filtering units, called nephrons, are damaged. Urine that appears darker or oddly pale, or that comes in significantly reduced amounts despite normal fluid intake, can also point toward impaired filtration. Some people notice they are waking multiple times a night to urinate, a symptom frequently dismissed as an aging bladder rather than a kidney under strain. Clinicians at Cleveland Clinic have long noted that changes in urinary habits are among the most consistently overlooked early indicators, largely because they develop gradually rather than overnight, one slightly different bathroom trip at a time until the pattern becomes the new normal without anyone noticing the shift. The fourth sign is a persistent, unexplained itch that seems to come from nowhere and responds poorly to lotion or antihistamines. When kidneys can no longer clear waste products effectively, those toxins build up in the bloodstream and can settle in the skin, triggering a deep, maddening itchiness that has no visible rash or obvious cause. It is a symptom people often attribute to dry weather, allergies, or aging skin, when in reality, it may be the body's way of signaling that its internal filtration system is falling behind, quietly asking for help through the only language it has left. The fifth sign is a metallic taste in the mouth accompanied by a loss of appetite or an aversion to foods, particularly meat. As waste products accumulate, they can alter taste perception and even cause breath to develop an ammonia-like odor, sometimes described by patients as tasting faintly of chemicals. This can lead to unintentional weight loss, nausea, and a general disinterest in eating that people frequently misattribute to stress, a stomach bug, or a temporary loss of appetite tied to nothing in particular. Family members sometimes notice this change before the person experiencing it does, commenting on smaller portions or skipped meals long before any medical explanation enters the conversation. The sixth sign is difficulty concentrating, often described as a kind of mental fog. This connects back to anemia and toxin buildup affecting oxygen delivery to the brain. People report struggling to focus at work, forgetting small details, or feeling mentally slower than usual. In a culture that already normalizes exhaustion and distraction, this sign is perhaps the easiest of all to explain away, folded into complaints about being overworked or simply needing a vacation, when in truth the brain itself may be starved of the clean, oxygen-rich blood it depends on to function clearly. The seventh and final sign is persistent pain in the back or sides, just below the rib cage, where the kidneys are located. Unlike muscular back pain that intensifies with movement, kidney-related discomfort tends to be a dull, constant ache that does not ease with stretching or rest. It can sometimes be mistaken for a pulled muscle or poor posture from long hours at a desk, when in fact it may be inflammation or swelling within the kidney itself, sometimes linked to infection, polycystic kidney disease, or advancing chronic kidney disease. This kind of pain rarely announces itself with urgency, which is exactly why so many people wait weeks or months before ever mentioning it to a doctor. What makes these 7 signs so dangerous is not their severity individually, but their invisibility collectively. Each one, taken alone, sounds almost mundane: tiredness, a bit of swelling, an odd taste, some back discomfort. None of them scream for attention the way chest pain or sudden numbness does. And that is precisely the design flaw in how humans interpret bodily warning signs. We are wired to respond to sharp, urgent pain, not to slow, cumulative decline. Dr. Joseph Vassilotti, Chief Medical Officer of the National Kidney Foundation, has spoken publicly for years about the organization's efforts to encourage routine screening, particularly for people with diabetes, high blood pressure, or a family history of kidney disease, precisely because these risk factors quietly compound the danger long before symptoms surface. Diabetes and hypertension deserve particular attention here, because together they account for the majority of chronic kidney disease cases worldwide. High blood sugar gradually damages the tiny blood vessels within the kidney's filtering units, while high blood pressure forces those same fragile vessels to work under constant, punishing strain. Over years, this combination erodes filtration capacity so slowly that routine checkups can miss it entirely unless specific kidney function tests are ordered. This is why physicians increasingly urge people with these conditions to request an estimated glomerular filtration rate test and a urine albumin test annually, rather than waiting for symptoms that may never clearly announce themselves until the disease has advanced significantly. The broader medical community continues to stress that these 2 simple tests can catch kidney disease years before any of the 7 signs discussed here would ever appear. Yet screening rates remain low, in part because kidney health rarely enters public conversation the same way heart health or cancer screening does. There is no widely recognized ribbon, no major annual campaign with the same cultural saturation, despite the disease affecting hundreds of millions of people globally, according to data compiled by the International Society of Nephrology. This quiet public neglect mirrors the quiet biological progression of the disease itself, and the 2 reinforce one another in ways that delay diagnosis for far too many people, year after year, generation after generation. Behind every statistic is a person who ignored what felt like nothing, a little more tired than usual, shoes a bit tighter, an itch that would not quit, and who later learned, often in a hospital room, that their kidneys had been struggling for years. These stories are not meant to induce fear for its own sake. They are meant to restore attention to a part of the body that asks for very little until it is nearly too late to ask at all. The kidneys do not announce their decline with drama. They whisper in symptoms so ordinary, they blend into the texture of everyday life, and it takes a conscious act of listening to hear them at all. There is also something quietly hopeful buried within all of this. Unlike many other organs, the kidneys often respond well to early intervention. Managing blood pressure, controlling blood sugar, staying hydrated, reducing sodium intake, and avoiding unnecessary overuse of certain pain medications can meaningfully slow or even halt the progression of kidney damage when caught early enough. Nephrologists frequently note that the difference between a manageable condition and a life spent on dialysis often comes down not to luck, but to timing, to whether someone paid attention to the whisper before it became a shout. If there is one thing worth carrying away from this, it is not anxiety, but awareness. The body rarely fails without warning. It fails without being heard. Paying attention to persistent fatigue, unexplained swelling, changes in urination, unusual itching, shifts in taste and appetite, mental fog, and quiet back pain is not about assuming the worst. It is about giving your body the same respect it has quietly given you every single day, filtering, balancing, and protecting you long before you ever thought to ask how. Sometimes the most serious conversations your body will ever have with you are the quietest ones. And learning to listen may be the difference between catching something early and discovering it far too late.